So I do have one new case to tell people about today, but pleasingly this is not an example of community transmission of something that's just popped up out of the blue, but it's a close contact of a previous case. And because we got onto this outbreak very, very early, they were already in quarantine, and so they don't pose any risk at all to the community. He's been in quarantine since his partner tested positive. So it's definitely linked to the Parafield cluster. And as I indicated yesterday, we do expect to see more cases, but we are hoping that they will all be people in quarantine. And we are actually doing regular testing of people in quarantine. They get a daily symptom check, and we will be expecting to see that because of the incubation period, and it's about now that we expect to see those cases. So just in terms of some statistics, there's 26 cases now linked to the cluster. And good news, we only have one person in hospital. So the woman in her 80s has also been discharged along with her husband yesterday. And they are stable and they've gone into a Medi hotel again because they are still considered infectious. There have been now just over 5,400 close contacts or contacts of close contacts in quarantine directly linked to this cluster. So given that we haven't even had a week to have had that number of people identified and contacted and put into quarantine is a testament to the sort of hard work my team has been doing, the partnership with SAPOL, but also to the members of the South Australian public who have put up their hand and said, yes, that's me and I need to go into quarantine. So we still have some work to do, but just to say we have made huge inroads into the investigation and getting on top of this outbreak. Now, in terms of our testing stats, we have 37 active cases and a total of 554 total cases now in the state. But in terms of our testing stats, we have a really high level of testing here in South Australia. So over 19,000 tests in total yesterday. So if anyone's been keeping track of how many tests are done in very large states like Victoria, New South Wales, you'll appreciate what this number really means. Normally, you know, on a good day, we were getting 2,000 or 3,000 people tested. The labs have been able to crank up and get that turnaround of 19,000 tests. Now, people might think with so many tests in the system, what's our test time like, the turnaround time of testing? It's an average of 28 hours, so just over the 24 hours. But what I did want to stress is we have now got a system in place to absolutely focus on the people we're really keen on getting tested from our communicable disease perspective. And in fact, for that case, that I'm telling you about this morning, his test was back in 90 minutes. So for people that we have particular concerns about, we can prioritise that and we're getting those tests turnaround time very, very promptly. It is now the time of this outbreak that we will start to see in the next week anyone in the community who we haven't been able to identify through our extensive contact tracing who may start to become positive. So this is the time for all South Australians, regardless of where you are, to really think about the fact that you might be becoming unwell, you might be getting a little bit of a sore throat, runny nose and such like, and it will be this next week where it won't be that you've been told by CDCB to get tested or you think that you've been to one of the venues that we've listed, and that's a really big message for people today. This next week for us is critical in our state. Just to say that we do have considerable capacity, particularly at Victoria Park Racecourse Testing Station for people if you need to get tested. So yes, it's the time for us to search for that general community transmission. A couple of other things I wanted to mention about our investigation to date. Whilst we have, over 5,000 contacts and contacts of close contacts in quarantine, there's about 40 close contacts who we haven't been able to get hold of directly. So everybody receives an SMS message to be told you're a close contact and you must go into quarantine and get tested. But of course, we want to follow that up and speak to people directly. There's about 40 that we haven't been able to get hold of, and that's a big push today. So we've got SAPOL helping us with that. Now, mostly those people will have got the message and they will be in quarantine, but we need to know for sure. And there's a few families from Roma Mitchell School. There's still people, obviously, from the Woodville Pizza Bar. Also, Flinders Uni School of English, if you happen to be a student there, there's a few of you that we haven't been able to get hold of directly. So if you're listening to me, if you could phone into our hotline. And there's a few people associated with Anglicare Brompton, not the workers, but that will be the contacts of the close contacts. So that's where we're up to. I also wanted to take this opportunity of just explaining a little bit more about our strategy in South Australia, and I know there's been quite a bit of media interest in that, and why have we done what we've done, and why have we done something different to what was done in Victoria and New South Wales and the like. So I thought first it's useful to go through this in terms of the timeline. So when we first got our first case, just recall that came out of the blue suddenly in the middle of the night on Saturday night last week. And the real reason we picked that up was not because somebody had classic COVID symptoms and came to the emergency department. It was because of our astute young junior doctor, who heard a bit of a cough and thought they'd take the swab. And that's where we started. The second part of this is that the contact tracing very quickly on Sunday was able to identify that it was linked to a Medi hotel. And subsequent to that, we did this huge blitz of testing in the Medi hotel. And that's how we picked up the additional cases at that Medi hotel. The other thing that I received very early on was information about the people's swab results. And what that showed was it was pretty early in the infection. And that meant that we had this very small window of opportunity. We were really early and we could get in early. And we also get serology results, and that's the antibody levels in people's blood that shows whereabouts they are. And there were very low, if no, antibody responses in that family cluster, which meant we were just at the early stages of this. So this is quite different to what had happened in Victoria and New South Wales, where things had actually evolved to quite an extent before they knew anything about it. But we had this opportunity here in South Australia to really nail it down. And then because of the blitz at the hotels, we then had this, on Tuesday, this other worker at a different hotel test positive. And the only reason why we picked up this case at the Stamford was because we had done our blitz testing on Monday and we got that test back very, very quickly. The other thing that was obvious to me and also my clinical team was that the incubation period was very short, and we were seeing within 24 hours people able to infect other people, which meant that the generations would be very short, and we were seeing this generation of about 3 days between the first person infected to passing it on to the next generation of contacts. And it meant that we had to move very, very quickly. And as I said, we had this very small window of opportunity. We didn't sit on our hands. We got on and mobilised not only our own contact tracers, but we mobilised interstate contact tracers as well, because we really had to go fast. And of course, then we had this additional information that we could put the pieces together, that the Stanford case was linked to the pizza cluster. And of course, as you're all aware, our initial information was that this was somebody getting a pizza, and that meant that there were lots of other people in Adelaide who will have got pizzas from that pizza bar, and there was a long infectious time, about 10 days, that we were concerned about. So putting all of those pieces of information together is very complicated, but we had an opportunity here in SA to stamp this out and not go on and have community transmission that would mean longer term shutdowns and also potentially border controls from other states. So this is exactly why we did what we did. And so really, to be clear, the decision to lock down hard, and I know it's been very difficult for people in South Australia and perhaps difficult to understand, was not based on the interview with one man. We would never make those decisions in isolation with just one piece of information. It's very complex. And the other thing in public health, in fact, in the Public Health Act, I have a set of principles, and the first one of those is the precautionary principle, and that's about acting swiftly without necessarily having all the information, because if you wait too long, you have missed that opportunity. And again, I was acting using that precautionary principle. So we didn't have a second chance to beat this wave, but we are really getting on top of it now, as you can see in terms of the numbers of people in quarantine. I just also wanted to stress that whilst I'm so pleased actually to see people out walking and exercising this morning, it really put a smile on my face as I came into work. And I'm really pleased that we can lift those harsh, that pause that we put in place as of midnight tonight. But it is very important that people who are in quarantine stay in quarantine. You still are at the highest risk, and you must stay in quarantine for that full 14 days. You also need to have a negative test result before you come out of quarantine, so that's very, very important. And for the rest of South Australians, this is the time that we may start to see any leakage in our, our attempt to keep this under control. So any South Australian who has any symptom at all needs to get tested. The other thing that you might be wondering about is, should we be wearing masks? And yes, masks are an easy thing to wear. It's not too much of an imposition, and it means that we are just dampening down any further risk of community transmission as we continue to do our work to contain this outbreak. We are not out of the woods yet. And I just want to thank all of the journalists in the room today who are wearing their masks, and a reminder that the mask does need to cover your mouth and nose to be effective.